You know what's scary? Nearly half of heart problems don't start with that dramatic movie style chest pain. Nope. Sometimes your heart's in trouble and it whispers instead of screams. And those whispers, most people brush them off as just getting older or probably nothing until it's too late. I'm not here to freak you out. I'm here to make sure you're one of the people who catches those warnings early. Because if you know what to look for, you can literally save your own life. And today I'm going to break down 5 of the sneakiest, most easy to ignore signs your heart might be waving a red flag. Signs you've probably felt before without even realizing what they meant. Stick with me because in 3, it's so common that I'm willing to bet you or someone you love has experienced it this month. When we talk about silent signs of heart disease, we're talking about symptoms that don't wave a giant red flag. No crushing chest pain, no dramatic collapse, just little changes in your body that you might chalk up to age, stress, or a busy week. The danger? Your heart can be struggling for months or even years before the big warning signs show up. And research backs this up. The American Heart Association found that up to 45% of heart attacks are considered silent. That means almost half of people had warning symptoms but didn't recognize them until after the damage was done. Think of it like a smoke detector that only beeps once every few hours. Easy to ignore, but a sign something dangerous could be brewing. My goal today is to make sure you know what those beeps sound like, so you can take them seriously and act fast. All right, let's break down the 5 silent signs of heart disease you should never ignore. The first silent sign is one you might never connect to your heart: unexplained fatigue. I'm not talking about the tiredness you feel after staying up late or running errands all day. I mean a deep, lingering exhaustion that hangs around no matter how much rest you get. Here's why this happens. When your heart isn't pumping blood efficiently, your muscles and tissues don't get the oxygen and nutrients they need. It's like trying to run a marathon while breathing through a straw. Your body has to work harder just to do everyday things. Over time, that constant low level strain leaves you feeling wiped out, even from simple tasks. I've had patients tell me things like, I thought I was just getting older, or maybe I'm working too hard at the office. But when we ran the tests, it turned out their heart was already under stress. If you notice, you're struggling to get through activities that used to feel easy, whether that's walking the dog, climbing a flight of stairs, or even cooking dinner, and there's no clear reason, don't brush it off. Your heart might be trying to tell you it needs help. The second silent sign is subtle shortness of breath, and it's often more dangerous than it sounds. Now, sure, we all get winded if we sprint up a hill or push ourselves at the gym, but what I'm talking about here is feeling out of breath during activities that never used to bother you, like walking across the parking lot, climbing one flight of stairs, or even just carrying groceries into the house. The reason this happens is pretty simple. When your heart can't pump blood effectively, fluid can start to build up in your lungs. That makes it harder for oxygen to get into your bloodstream, so you feel winded faster. It's not that you've suddenly lost all your fitness, it's that your body is struggling to keep up with a reduced oxygen supply. I've seen patients say, maybe I'm just out of shape or it must be the weather. But in reality, their heart was the real reason. Here's the thing: your lungs and heart are teammates. If your heart is lagging, your lungs have to pick up the slack, and they can only do that for so long. If you start noticing that your breathing feels heavier, shallower, or just different, and especially if it happens without a clear cause, it's time to pay attention. Your heart could be sending you one of its quietest but most important warnings. Silent sign number 3 is something a lot of people notice, but don't connect to heart trouble, swelling in your feet, ankles, or legs. Here's what's going on. When your heart isn't pumping blood as strongly as it should, circulation slows down. That means fluid can start to pool in the lower parts of your body thanks to gravity. Your tissues soak up that extra fluid, and you end up with swelling, what doctors call edema. A lot of my patients first notice this when their shoes start feeling tighter by the end of the day, or when they take off their socks and see deep marks left on their skin. Sometimes their ankles look puffy in the mirror, but they just assume it's because they've been standing a lot. Now, Swelling can happen for other reasons: hot weather, a salty meal, even certain medications. But when it's happening regularly or it gets noticeably worse without a clear reason, that's when your heart might be to blame. Think of your heart like a water pump. If the pump slows down, the water, or in this case blood, starts to back up. That backup increases pressure in your veins, which pushes fluid out into your tissues. The result: puffy feet, ankles, and sometimes even your calves. So if you start noticing that your lower legs are swelling more than usual, and especially if it's paired with other symptoms like fatigue or shortness of breath, it's time to get it checked. Your body is trying to tell you something important. Silent sign number four is one that surprises a lot of people: discomfort in your jaw, neck, or upper back. When we think of heart trouble, we picture pain in the chest. But here's the thing: your heart and these areas share nerve pathways. That means your brain can sometimes misinterpret where the pain is coming from, a phenomenon called referred pain. Instead of feeling pressure in your chest, you might notice a dull ache in your jaw, a strange tightness in your neck, or even soreness across your upper back. I've had patients come in thinking they just slept in a weird position or maybe strained a muscle, but when we dug deeper, it turned out their heart was the real source of the problem. And here's a key point: this type of discomfort is especially common in women who are more likely to experience non traditional heart attack symptoms. The pain or pressure can come and go, or it might show up during physical activity and fade when you rest. Some people describe it as a heaviness, others as a burning or pulling sensation. The danger is that because it doesn't scream heart problem, many people ignore it. But if this discomfort is new, unexplained, and especially if it's accompanied by fatigue, shortness of breath, or sweating, don't shrug it off. Your heart could be waving a warning flag, just not in the place you expect. The fifth silent sign is one that almost nobody links to their heart: digestive changes like nausea, indigestion, or even a feeling of stomach discomfort. At first glance, this sounds like a problem for your stomach, not your heart. But here's the connection: when your heart is under stress, like during reduced blood flow or an early stage heart problem, it can trigger your vagus nerve. That nerve runs from your brain to several organs, including your heart and digestive system. When it's stimulated, it can create sensations that feel a lot like stomach upset. That's why some people experiencing heart trouble think they just have acid reflux, food poisoning, or something they ate that didn't sit right. In reality, it's their heart signaling distress. I've seen cases where someone thought they had the flu because they felt nauseous, weak, and sweaty, but when we ran the tests, it was actually a heart attack in progress. This is more common in women and in people with diabetes who may have less obvious chest pain. The tricky part is that these symptoms can be mild and come and go. Maybe you notice indigestion after a light meal, or you feel queasy for no clear reason. But if this is new for you, happens alongside fatigue, shortness of breath, or any other symptoms we've talked about today, don't ignore it. Your heart and your stomach might be speaking the same language, and it's worth listening closely. All right, let's run through those five silent signs one more time, because these are the kind of things you don't want slipping out of your memory. Number one, unexplained fatigue. That deep, lasting tiredness that sticks around no matter how much you rest. Number two, subtle shortness of breath, getting winded during simple everyday activities you used to breeze through. Number three, swelling in your feet, ankles, or legs, especially if it's happening regularly or leaving deep marks when you take off your socks. Number four, jaw, neck, or back discomfort, strange, unexplained aches that could be your heart's way of asking for help. And number five, digestive changes like nausea or indigestion, symptoms most people never connect to heart trouble, but that can be an early red flag. Now, here's the important part: each of these on its own might be easy to shrug off, but when you notice more than one or they keep showing up without a clear reason, that's your cue to take it seriously. Your body is an incredible communicator, but only if you're paying attention. Ignoring these signs isn't just risky, it could be life changing in the worst way. So store this checklist in your mind and listen when your body whispers. If any of these signs sound familiar, here's my advice: don't wait. Make an appointment with your doctor and get it checked out. The worst case scenario, you get peace of mind knowing it's nothing serious. The best case scenario, you catch something early enough to treat it before it becomes dangerous. Heart disease is one of those conditions where early action can literally save your life. And remember, nothing in this video replaces professional medical advice. I'm here to give you the information, but your doctor is the one who can give you the diagnosis. So pay attention to your body, take these signs seriously, and never feel embarrassed about getting checked, because the people who love you will thank you for it. Now that you know what to watch for, my next video covers the 7 everyday habits silently damaging your heart and how to reverse them. You might be doing number 3 every single morning without realizing it.